So I would like to ask for your permission to use this video for educational purpose.
Yes.
Excellent. Now, tell me about your symptoms before the surgery.
I had severe pain down my leg, left leg.
1 to 10,
Yeah.
how bad was that pain?
Oh, it was 9.
9.
Yeah.
And the back pain, how bad was the back pain?
My back pain was right up around there, 7 or 8.
7 or 8. Now, the surgery was about 10 months ago after all the conservative therapy failed. Now, how is the leg pain now?
I have no leg pain anymore.
Excellent. But you know what? You have still some back pain. Tell me a little about that. How bad is it?
It depends on what I'm doing, but it can go up to an 8 or 9, but a lot of times it's down around 4.
Usually it's 4, but
Yeah.
depending on the activity can be up to 8. Now, I'm just going to swing here and show that we did the OLLIF, that minimal invasive fusion, and the bone in the 4-5 here growing through, and in the 5S1 as well. The bone is actually growing in the interbody. In the back, what we see that the one of the facets is growing. 3 of the facets or the bone in the back are still pending. But most importantly, I'm able to see that the sacroiliac joint, where connect your sacrum to your iliac or to your pelvis, the bone is getting a little arthrotic there. You have some arthrosis there, as well as there's some vacuum effect, we call it, or air inside of the joint that tells me that joint is in a bad shape. And now, just a minute ago, I provoked that joint, and that made your symptom actually worse.
Yes.
So at this point, you have actually 2 reasons for you still have some back pain. One is that the back of the bone is not growing, but more importantly, that this might be something else, which is a problem of the sacroiliac joint. And we talked about that we are going to actually numb up the sacroiliac joint to see if we put some local anesthetic there. If the pain goes away, then we know how much of the pain is coming from that. Now tell me about the activities that make your pain worse. What are those activities?
If I stand for long periods of time, that gets worse.
Okay.
If I'm bending forward and pushing down on stuff, it gets worse.
What about twisting?
Twisting, I get twinges, not,
Okay.
not prolonged pain, just,
Okay.
sharp.
So, and you have as well diabetes that actually make the recovery time a little longer, but bone growing after 10 months is a very good thing. And I think at this point, 80%, I think your problem coming from the sacroiliac joint rather than the back, but we will investigate that.
All right.
Okay, overall, how happy are you with the result of the surgery itself so far?
Oh, I'm happy with the results.
Excellent, excellent. Thank you very much for the interview.